After managing the patient's airway as necessary and identifying the signs of a tension pneumothorax, we'll assemble the necessary equipment. For this skill is a 14 to 16 gauge needle, iodine or alcohol solution, 4x4s, tape, a sharps container, and PPE, which for this skill is gloves and eye protection. After donning PPE, the first step is to identify the proper decompression site. The proper site is the second or third intercostal space on the mid-clavicular line. Identify the site and clean with the proper solution. Reconfirm the site. Insert the catheter vertically over the top of the rib. Listen for a rush of air. Remove the needle, leaving the catheter in place, and immediately dispose of the sharps. Secure the hub with 4x4s and tape. Reassess the patient's ventilation, lung sounds, pulse, and blood pressure for improvement.